Hello, everybody. Welcome. We're here with Chelsea Eilts. She's a doctor of naturopathic medicine and functional health expert who helps women regain energy, metabolism, and hormone balance. Thank you for being with us.
Oh, such a pleasure. Thank you for having me.
Thank you. So let's go and start talking a little bit about the importance in preparing the body to be able to detox when we are, for example, removing amalgams or mercury fillings, then what it is that we need to do beforehand.
Definitely. So, from a holistic or whole body health perspective, there are different systems that are impacted by detox. Most mercury is going to move through the liver and kidneys, and then through the bowels and through the urine to get out of the body. So, these are some of the primary areas that I focus on with my clients in order to prepare for detox. So, what that looks like essentially is getting healthy liver function happening, do some preparation around healthy digestive function, and then also really supporting the kidneys. Sometimes just through basic nutrients can make a huge difference, and a healthy anti-inflammatory diet, and then also using certain herbs and supplements just depending on what your health history is.
One of the things that a lot of people don't know is that when we are removing amalgam fillings or the mercury, the silver fillings, the heat of the handpiece or the burr is going to start making that vapor of the mercury come out. So we don't want the patients exposed to this, inhaling it, and then of course absorbing it. The oral mucosa, the mouth is absorbs. It's just really easy for it to absorb all this vapor of this mercury
Mhm.
into the bloodstream, into the body. So
Mhm.
then we have to prepare them beforehand. And what are your recommendations? What do you like to use so the body can we can just take that out of the system?
Well, definitely an anti-inflammatory diet is important because if there's any kind of what we call leaky gut, or just where the lining of the digestive tract, including the mouth, is a little more porous, that would of course allow more mercury to move into the bloodstream. So an anti-inflammatory diet can really help to tighten up that boundary and make it have a better integrity. uh, Glutamine is another nutrient I really like for helping to tighten up the integrity of the digestive lining. But then in terms of things to just bind up the mercury that's being has moved into the circulation, of course, binding agents can really help. Some of my favorites, of course, activated charcoal is really popular, has been used a really long time to support this. Um, Fiber, dietary fiber is a really big one. So, modified citrus pectin, or just eating high fiber foods, getting psyllium husks, things like this can really help to bind up and absorb, like just help to carry these toxic metals out of the body. Another that I'm really fond of is humic acid. So, you can find humic fulvic liquids that I have clients use sometimes, just depending on how acute of an exposure. So certainly having amalgams out would be qualify as a pretty acute exposure.
And those are very easy for people to get. I know that the mercury is a heavy metal. So because it's a heavy metal, we need a really strong binder. So I know that it is important first to check if there is mercury toxicity in the body. So have a blood test, make sure that you're not having a really high level, because if you're having a high level, you don't want to be removing all the amalgams at once. You need
Right.
to probably do it slowly. But what are other things that are like stronger that are going to take this um, heavy metal from the body that they can do? So that they probably will have to go to an office like yours and then do some other more involved um, therapies to be able to get that heavy metal out of the body.
Yeah, definitely. And especially if amalgams have been there a long period of time, possibly releasing particles, they can accumulate in different tissues of the body. Mercury really likes the brain and the nervous system, but can also move into other tissues. So, certain agents called chelating agents are used to essentially go into those places where mercury is stored and pull it out of the system. So, chelating agents, the really strong ones that are often used only under supervision of a physician, are things like EDTA, DMPS, or DMSA. Sometimes they're given orally or sometimes through IV, just depending on the provider and their experience and how your level of exposure, essentially. There are also things in the herbal realm that I've used with clients to kind of move a bit more slowly. So it really depends. If your health history, you're very robust and able to withstand stronger chelating agents, then that's the direction I would typically go, using things like EDTA. If their systems are maybe a little bit more compromised, or maybe you've had just higher levels of exposure, sometimes the herbal therapies like using cilantro and chlorella, a type of seaweed, can be really helpful for pulling those out a little bit more slowly, doing something over maybe 6 months rather than a shorter time frame.
And then what are the symptoms that you have noticed with patients that are more like have a little high toxicity level with, especially with mercury or heavy metals?
It's kind of incredible that how many systems can be affected by mercury. I mean, going through the literature, most of our major organs can suffer damage from mercury toxicity because it kind of eats up our antioxidants and causes quite a lot of inflammation. But like I said, it definitely has an affinity for the nervous system. So it can cause a lot of issues in brain, for children, brain development, for adults, even things like mood and cognitive function, memory, attention, concentration. There's even been some correlation with Alzheimer's and Parkinson's. So that's definitely an area where there's a lot of research happening, but an area that's interesting to keep watching. Beyond that, we know that mercury can disrupt our hormones. So things like thyroid function, sex hormones, adrenal function as well can all be impacted by mercury toxicity, and a number of heavy metals as well, which is why I always like to loop in a bit of detox with people when I'm doing deeper health work like this. And then also, things like our vital organs, heart function and blood pressure can be impacted. If people have high blood pressure, mercury could be a factor there. Issues with the liver and kidneys as well. We'd want to just know what's causing the issue there. And certainly heavy metal toxicity can be a big one.
That is so true. And especially my patients, they come after they have explored all these different avenues where they go to a functional medicine doctor and a naturopath, integrative medicine, they go to the Western medicine doctor. And they are just frustrated. A lot of them definitely foggy brain,
Mhm.
loss of memory. They just struggle with that. Just more like neurological, and it's affecting them emotionally and psychological as well because they're frustrated. Everybody's telling them everything seems normal in your regular lab results, but then going deeper, or a lot of women, they're struggling with thyroid and their hormones are just out of control. And this could be one of the reasons of their imbalance. So this is great, that is a really good point in there to touch with the hormones.
With the hormones, absolutely. And then another one sometimes that can be a little harder to parse out is immune function. Certainly, there's some correlation with heavy metal toxicity and autoimmunity, which, you kind of bring up a good point. People can go from doctor to doctor to doctor, and like, I'm doing all of the things I don't understand, but it does seem in our country how dental care and internal medicine there's a big divide there, where sometimes the crossover isn't as seamless as it should be, really. That we're like, okay, oh, the last thing we look at might be the teeth, and it could be one of the biggest contributing factors. So great point there.
Absolutely. It's just like they think that the mouth is just part outside of the body and it's just a big part. of the
Mhm.
body. So it is really critical for people to just really pay attention of, because what I tell them is that, what I tell my patients is that you have a lot of signs in your mouth that are indicating that there is something going on in the rest of the body. So the mouth has a lot of keys or clues that is telling us the body is not balanced. So we need to start investigating a little bit more and see what's happening. And
Definitely.
what now, I like that you touch the immune system, because then I want to go to the next topic I want to talk about, which is healing. For example, if we're having a little surgery like gingival surgery, or even just a regular like a hygiene appointment, we want good healing. But especially when I'm having to remove a tooth, for example, we want to have a good immune system. And then one of the most important part of the immune system for me to say yes, we're going to be able to do this extraction, remove this tooth, is if the vitamin D levels are ideal, which I would like them to be between 60 and 80. And
Mhm.
being here in the Pacific Northwest, my patients lately is like 20 or below. What do you think about that? Or what is your recommendation? What is your advice on maybe what can we do to improve and boost that immune system?
Yeah, I mean, definitely vitamin D levels. UVB exposure every latitude north of San Francisco is lacking in terms of what we need to essentially produce enough vitamin D to keep us healthy. And vitamin D is incredible. It affects so many systems of our body, including the immune system and even DNA synthesis. So definitely vitamin D levels. I always find liquid vitamin D absorbs better for people, especially taken with fatty, like with a meal, so that it being fat soluble, you have food beside it. And testing is really important to make sure that a person's on track for building up their vitamin D levels. But also, general antioxidant status is very important. So, vitamin C levels can be really helpful for tissue healing and recovery. And basic nutrients. A lot of people are nutrient deficient. If we look at the standard American diet, if we look at what kinds of minerals and essential vitamins we're getting into on a regular basis, sometimes that's lacking and may need to be addressed before going through a surgery. Also, protein deficiency. So sometimes, when we're having to repair tissue in the mouth or elsewhere in the body, we have to be able to lay down new tissue, and our body uses protein to do that. So, vitamin C helps our body to actually turn the proteins that we eat into collagen and lay that down. So, kind of looking at these basic nutrients might seem so simple, but it's huge and has a really big impact on your ability to recover quickly and fully after a surgery. So that's always where I start. And then, of course, just looking at if there's so those are the things we can add. But then, if we also look at things that maybe need to be removed, if maybe we're getting into things that cause a lot of inflammation in the body, that should be addressed as well before surgery, so that inflammatory response can be better controlled and there's just less fallout from something like an invasive procedure.
Correct. Yeah, and then protein part is really important. It's key. What I've noticed is like my patients that are vegetarians,
Mhm.
their healing is a lot slower. So in those cases, I actually recommend if they can have at least bone broth or something that will have some animal protein, it will improve and is noticeable. Like when I place the implants and the implant is not very stable, it's like, okay, instead of healing and getting stronger, it's just stuck. It's not getting really stable. So then I asked them, okay, let's increase that animal protein, at least bone broth. Let's do something because the animal protein is going to help that bone to get a little more solid and stable.
Mhm.
So that's really important too. What do you think about what levels? Because I am recommending if they are below 30, 35 on their vitamin D level, to start bumping it up to 20,000 IUs a day for a temporary period of time.
Mhm.
What is your idea on vitamin D and also vitamin C? What levels do you recommend?
So with vitamin D, yeah, anything under 50, and I usually have people bump up their dosing pretty high. I mean, sometimes they'll start at 5,000 IU per day for a 3-month window and then retest. But it usually in my practice, it's not something that's so, we're not waiting on a procedure. So it definitely makes sense to bump up the dose a lot higher if you're trying to get values raised more quickly, of course. So, I've seen a variety of dosages, 10,000 IUs, 20,000 IUs. Of course, it's a vitamin where there's some evidence we can overdo it. So making sure that you're doing regular testing, if a person's, say, taking that quantity of vitamin D on a daily basis, I wouldn't think you'd want to go more than a couple of months at that dosage without taking a peek back at blood work and seeing where things are at. But that makes sense to rapidly replete the system. And when it comes to vitamin C, again, in my practice, typically I'm not doing a lot of pre-surgical care. So usually during something like chelation, I'll have people taking usually liposomal vitamin C since
Mhm.
it's better absorbed, at something like 1,000 milligrams 3 times per day, or to bowel tolerance, because of course oral supplements can cause loose bowels, and which can be a limiting factor for being able to get higher doses in. Though I've certainly seen pre-surgically IV vitamin C being administered, because of course it kind of bypasses absorption, it bypasses liver metabolism, and kind of gets the nutrient right into your system very quickly. Doses there, of course, can be much higher. A person, of course, would do this under physician supervision, make sure you're a good candidate for vitamin C IV therapy, but then dosages can be raised fairly high depending on how quickly you need that to get that level up for a person. A week before having any kind of surgical procedure, it would make good sense to have higher levels of IV vitamin C, not just for tissue recovery, but also for the antioxidant support. Because if things are being liberated in terms of heavy metals, it will help to mitigate any kind of damage in the body from that as well. So,
Mhm.
multiple aspects of what that can do for a person around what you do for sure.
And then one of the things that I recommend them also is to take the vitamin D with vitamin K.
hmm Yeah, absolutely. Another fat soluble vitamin, certainly for improving, if you're doing, say, implant surgery, for improving bone density, vitamin K is essential. It really helps our body to lay down new bone tissue. It's
Hmm.
integrated into bony tissue, and so the D and K will absolutely support, and D to help us absorb calcium as well. So all of these minerals work together to improve ultimately the success of what taking an implant and having it be successful.
Yes, and then one of the things that I tell my patients is like vitamin K is like the driver. So it's driving vitamin D to go into the places that we need it to work.
hmm And there's some really great combo remedies out there that bring K in with D. And so, I mean, it's easy to find, easy to do, not necessarily like you have to take so many different things. And
That's
it
great.
makes perfect sense. Yeah.
Do you have any recommendations? Because I feel like people would like to do something that is easy, effective, and just easy to remember as well.
Recommendations in terms of D
Supplements
and
and
supplement. Yeah.
the protocols that you probably will recommend.
Yeah. So, of course, a liquid DNK. I usually like liquids for those vitamins. I find for my clients that they tend to be better absorbed. For like a pre-surgical protocol, I like a good multivitamin. Seeking Health is one that I turn to, optimal multivitamin powder. And I usually do that for people about 2 to 4 weeks before any kind of surgery. Um,
Hmm.
Vitanica has a really nice multi-mineral, multi-nutritional product called Opti Recovery that I like to give 2 weeks before surgery as well, just really giving the nutrition that the body needs to recover effectively. In the world of homeopathy, arnica can be really helpful before and after a surgery in a little more of an energetic way to support tissue healing, healing from bruising, healing from deeper soreness. All of that can move a little bit more quickly with some arnica. And usually around surgery, I would use a 30C potency for that. And nutritionally, I like to make sure that there are good flavonoids, so good rich plant pigments, getting into things like dark berries, dark leafy greens, things like this, curcumin, so from turmeric, different things like this can really help to reduce inflammation in the body. So again, just with the less inflammation we can have going into a surgery, usually that bodes well for recovery. And
Mhm.
then I like liposomal vitamin C from Seeking Health. Also, there's a good product from Vital Nutrients that sometimes I'll use. So those are good products that again help to just get up vitamin C status. It's a good idea if a person's taking fish oil, which usually I recommend for most of my clients who have a hard time getting enough omega-3. It's good to just discontinue that a little bit before surgery too, since that can increase bleeding risk
Readings.
a
Mhm.
little bit more. So that's kind of pre-surgery supplements and things that I like to get into. In the way of uh, heavy metal things, there's a really great product called the Universal Toxin Binder by Quicksilver that I like to use for binding up things that might be liberated from, say, an amalgam removal, or if there's anybody's going through any kind of chelation or using herbs or other chelating agents that might pull some of these things out of storage. That's a really nice one that combines multiple binding agents in one. So, kind of one easy way of getting that in the system.
That's amazing. Great. That's super, super good information. And it's something that the patients can get over, like, just really easy. And it
Hmm.
is important. Have you noticed? Because I've noticed with my patients, some of them, when they're taking the turmeric or curcumin, they have a little bit of bleeding as well.
Ooh, well, good to know. I've not seen this, though. Again, my practice doesn't involve a lot of surgical procedures. So,
Mhm.
certainly, if there's more bleed risk with curcumin, another one you'd probably want to discontinue a couple of weeks prior to a surgery. I wonder if it's taken through because it's not well absorbed. Curcumin, turmeric in general is not well absorbed, which is usually why we turn to kind of the curcumin, the more concentrated form. I wonder if taken as turmeric in food, if that would have the same effect, but I'm not sure.
Okay, very good. Is there something that you have noticed with your patients that are having the heavy metals, or that are you're noticing changes in their body, or especially in their mouth, when they're having like high toxicity levels, or if they're having their hormones in a balance, and then it might be connected with heavy metals as well?
Well, I mean, the symptoms can be so variable. They can be so variable. And because it can affect the brain, you can notice, I mean, things all over the place, like fatigue and brain fog and slowness to heal and recover. So we might be
Mhm.
doing things that make perfect sense and should be working, but aren't. So a lot of times people who just like, they're like, I don't have any energy for this and feel just sluggish, toxic, pick up every cold that comes along and then don't really do well with the normal supplements that should be working. That's oftentimes where my mind goes, like, there's something a little bit deeper here. The cells aren't functioning like how they should, because ultimately in a functional health world, we really want to look at what's going on in your cells, what's going on. Cells, if we give them what they need, they should be able to heal effectively. And if that's not happening, we have to say there must be an obstacle. There's something preventing these cells from functioning how they should. And certainly heavy metals can be one of those obstacles. Herbicides, pesticides, other things, of course, can accumulate in the cells and cause issues as well. But that's where my mind goes when it's like we're kind of doing all the right things and nothing's changing. Orally, though, I would kind of defer to a biologic dentist to say, what's going on here? If you're having, I've really just seen a lot of people with issues around root canals and like a tooth that has been worked on in the past where they're like, "Yeah, I'm always having soreness here. There's always a pocket in my gum here, or there's just something doesn't feel right about this tooth." And I say, let's get you into a biologic dentist because that makes good sense.
And do you have any like really incredible stories maybe after heavy metal detoxing?
Ooh, yeah. In fact, a couple of really kind of remarkable turnarounds. One, a little bit more of an intense case where someone had been dealing with a chronic infection, a chronic Lyme disease,
Mhm.
where they had been struggling with symptoms for maybe 5 years by the time they arrived in my office, and were in, just pretty sad shape in terms of no energy, not able to sleep, a lot of body pain, a lot of brain fog, even just hallucinations, things where their brain was really struggling. And even going through some of the antimicrobial therapy that was being prescribed to them, they weren't making very much progress. So we did a little bit of that foundational work to get their gut into a good place, reduce inflammation as best we could with their circumstances, and then started doing really gentle chelation therapy. And we did this about 3 months, and then all of a sudden they really started making massive improvements in terms of the infection. So the level of infection that they were dealing with all of a sudden started to move in the right direction, and there were a lot of signs that their immune system was starting to work effectively again. So anyone who might have experience with chronic Lyme knows that that's a big shift, and definitely saw that directly linked to doing detox work. um, I've also seen a lot of people struggling with water retention and weight troubles who do some heavy metal detox, and then the body just drops all of this excess water seemingly overnight. They do this detox protocol and then they're like, "Wow, I've been doing everything under the sun to try and control my weight, to try and control my hormones and all of this." And detox really created a meaningful and lasting shift.
Well, those are amazing stories. That's great. So,
Mhm.
how can people find you?
Yes. So I have a remote health consultation company called Gem Health. I have a website, gemhealth.coach. I'm also putting out a lot of free content because I'm just passionate about helping women and empowering people in functional health, like creating a new health paradigm, right? Where you can know what to do to care for yourself. I think that's huge. So I put a lot of content on Instagram. So at Chelsea Eilts is my handle on Instagram. You're welcome to pop in there, and yeah, I'd be happy to share resources. You can always pop into the DMs and ask for anything um, related to what we're talking about today. Absolutely.
And I think you have a little gift for our listeners.
Yes, absolutely. So, anyone who would like any kind of functional health consultation where we basically look at holistic health, what's going on in the body, I would do 33% off an hour consultation. You can just pop on Instagram or email me through my site at just the word detox is enough, and I would know where you're coming from, and I'd be happy to connect you with that. Also, if you DM me Detox on Instagram or email me, I'm happy to share a freebie I just put together that includes some of my favorite detox protocols and supplements. So, if that's beneficial to you and you'd like to get your hands on that, just pop over and let me know.
Well, thank you so much. Thank you. I appreciate it.
Of course, absolutely. Thank you so much for the amazing work that you do. We all need it.
Thank you.